Hello everyone. Today we are going to discuss about the first chapter in community medicine, where you understand what is community medicine, why this chapter is important. May not be very important from the exam perspective, but still you may expect some questions in Viva, in undergraduate examinations, and sometimes some MCQs also may be expected from this chapter. But the basic requirement of understanding this chapter is nothing but to understand the entire concept of community medicine, especially for the MBBS students who are studying community medicine for the first time, not to confuse it with the clinical medicine, because community medicine has its own span, own area where it works, and we have to understand how to apply which part in which subject of community medicine, which part against which aspect of community medicine. For example, in clinical medicine, you have to understand the latest modalities of diagnosis, treatment, and when you are asked a question about management of a disease in clinical medicine, you will be answering about the latest outcomes of research, what is found, and what is the best modality being followed. But in case of community medicine, not so. Here, the answer should be what is being provided through the government policies, so that the entire community is benefited and most of the population is benefited by the services which are provided under the program. That is why we have to understand the policies, why such policies have come, what is the benefit to most of the people. We have to understand the cost effectiveness of those benefits which are being given by the under the program and under the government policies. So that is why we have to understand why the subject community medicine has come, and what are the things we have to study, and what is the basic understanding of community medicine. Once we catch this concept, we can understand that how to read the entire subject and what is the crux of answering the questions in community medicine. So let's start. So the chapter is called Introduction to Community Medicine. It is a problem with the books which we read. See, most common book is the K. Park, Preventive and Social Medicine, in short you call it PSM. Now in that book, this chapter, Introduction to Community Medicine, has not been mentioned. Why so? Because see, this is preventive and social medicine. Community medicine is an evolved subject which has come a lot after the concept of preventive and social medicine. Say preventive and social. This means there are two aspects. One is preventive part, it's preventive medicine. One is social medicine. We shall come to that in the upcoming slides. Here, K part. It looks like the book adds two aspects of the medicine, which is preventive medicine to prevent the disease, the preventive aspect, and social aspects of diseases. But community medicine is a subject which is far more evolved than the preventive and social medicine. And what is community medicine, you will find in some recent books, not in K part, the definition and concept of community medicine. So this chapter, Introduction to Community Medicine, has been derived from one specific book. I cannot mention the name here, but very recent books, they are talking about such chapters of introduction into community medicine. But with the advent of time, this has become very important, and it explains the concepts of the community medicine. So let's proceed with our next page. See, what is community medicine? If we go to the definition of community medicine, you see community medicine is that branch of medicine. It's a branch of medicine. So entire medical study has been mentioned as medicine here, and it is a branch which deals with what it deals with study of provision of preventive. See, provision, you have to understand the meaning of the term provision. Every terminology is important in community medicine. Provision of preventive. Why provision? Because provision means what? Something which has been made, which is available to us. That is why it is provision of preventive, promotive, curative, rehabilitative, and evaluative services. So what are the things which are available to us though through the government programs, government policies, considering cost effectiveness and availability in the Indian market, though in the private sector, availability in the perspective of our financial condition and the perspective of availability in the market, those things which are available, provisioned to us, such preventive things, say some particular vaccine, it has been discovered, if it is not available in India, then we shall consider it is not, there is no provision for that vaccine. So that particular preventive aspect, there is no provision. So we shall deal with the things which have provision for preventive, promotive. In upcoming chapters we shall come to that what is promotion of health. Curative we always understand, but those which are curative services which are provision. Say for example, treatment of cancer, it is not provision free of cost to the entire population of India, but curative services for tuberculosis, that has been provision by program, and free drugs are available. So curative service which are provision, so provision of curative service. And rehabilitative services, say rehabilitative reconstructive surgery after leprosy complications, so these are available. Rehabilitation of mentally ill patients, that is a provision in India by Government of India service, or it has been made affordable to Indian community. But some other rehabilitative services of modernized rehabilitative services which may not be a provision, there may not be provision for that. So that is what we have to understand. So it explains which things we have to precisely focus on while studying community medicine. The definition itself reveals it. So you have to understand these things. And evaluative services. So we shall be also evaluating the services which are giving. And so evaluation of the health system is also a service. So say quality assurance program, where we are evaluating the services which are being provided by our primary healthcare system up to the tertiary level healthcare facilities. So under certain benchmarks we are evaluating how our services are. So evaluative services also are giving in this one. Say for NABL certification of laboratories, these are all evaluative services. So here we look out for the preventive services, promotive services, curative health services, rehabilitative health services, and evaluation of services for which there is provision to the community at large. See, so it is generalizable, available to everyone in the community, mostly those are who need it. So community at large, not for some certain people who have financial ability, but it is for a community at large at a cost which they can afford. Definitely may be free or such a cost contributory to the services which is affordable to the community, though through an organization comprehensive healthcare delivery system. Our healthcare delivery system is nowadays, it is called comprehensive healthcare delivery system. So through an organization we shall do. It can be government, not necessarily all government, it can be government, it can be private, or it can be by public private partnership or PPP models. Okay, so in all these aspects, such services which are provision. Now this is a community medicine. Therefore, community medicine is a new terminology, as I have been telling after a few minutes earlier. The community medicine is a new terminology. That is why all books are not covering that. So I will explain it here. Say first, the concept of health came with hygiene. At the very earliest period, people used to know that what is essential in health, and what is the aspect through which health can be maintained is hygiene. So we shall come to that, what is hygiene. Then came preventive medicine. So you see, preventive and social medicine, or PSM. When your part says the name of the subject is PSM, preventive and social medicine. So preventive medicine was one part. Next terminology is social medicine. So two things evolved, and the part combines both of them and makes a subject called preventive medicine, social medicine. Then a broader aspect came called public health, which means providing preventive medicine and social medicine comes the understanding of the subject. Preventive means the theoretical, how we can prevent the diseases. We used to develop such. Suppose we are developing vaccines, we are developing chemoprophylaxis. Chemoprophylaxis. This means where we give drugs to prevent certain health issues before it comes up. Okay, or vaccine, or say for non-communicable diseases like diabetes, hypertension, there are lifestyle modification such as exercise, yoga, these sort of things to prevent the disease. So we establish various preventive aspects. And social, what did social mean? Social meant that evaluation of our society, finding the factors which are leading to diseases in our society and to intervene against those diseases. For example, say social taboo. Social taboo. What is that? That is nothing but having such practices in which there are some privacy is maintained and people may not go to health facilities to reveal the problems. Okay, say women will not come to in some community, women will not come to the healthcare provider or health facility to talk about their sexually transmitted disease. They will not come. To talk about their problem. So this is a social taboo. So this is just an example. So how there are some social issues which can lead to or which can become a challenge in giving healthcare facilities to the people. So we shall be this was a study of the social factors. Now how public health came, it is a rather broader aspect where how to give this preventive medicine and social medicine to the public as a whole. See here in this definition we have mentioned community at large. So to reach out to the community at large, or we mean that to the public, how we can provide these services to develop entire ideas. So preventive and social medicine are understanding the science and developing the scientific concepts. Public health is more about implementing the services and making policies. This is public health, to reach out to the people and give preventive medicine services and social medicine services. So public health is much more broader than preventive and social medicine as a combined. Then came the community medicine. The term community medicine has evolved after all this terminology had evolved, which means that in community medicine what we shall do, we shall understand the public means the entire population, but community means there are different strata of population among the entire population. Say there is a stratification of community based on religion, based on caste, based on social beliefs. So we shall address every community based on geographical location of residence, where depending on those areas we shall evaluate the community, that which community has which sort of preventive medicine aspects are applicable for them, which social issues are applicable for which community. So depending on that, what should be the public health intervention methods to reach out to the community, to that particular community, to give them the services. So this is much more an evolved service than the previous terminology we have used. This is why now the subject is mostly called community medicine. So sometimes with the terminology preventive and social medicine is used, and some institutes use the term public health, because there is also a course called Master in Public Health, Diploma in Public Health. So basically all are studying in the same course curriculum, very much relevant to each other, but basic concept is community medicine, where we study the community, find out the social aspects, then this and the epidemiology of disease in that community. Then we find out what are the appropriate preventive aspects, and we find out the implementation strategy through public health concepts to reach out to that community and give them services. So how the entire concept came? See, at first there was concept of hygiene. Hygiene, how the term came? Hygiene is the word derived from a Greek word called Hygeia. Well, who is Hygeia? Hygeia is the goddess of health. So basically, hygiene is not only cleanliness; it means to the healthcare services. Okay, and disciples of Hygeia they used to call them hygienists. So at that Greek concepts, and in Hygeia, see, this is the image of the idol of Hygeia. So here you can see a serpent, a snake, who is drinking from a bowl. A snake drinking from a bowl in the hand of, kept in the hand of the goddess called Greek goddess Hygeia. So in Greek mythology, the serpent testifies the art of healing. So here what it means? It means she is holding the power to heal, and she is healing the community. And hygiene is defined as the science of health and embraces all factors contributing to healthful living. So in that those period, the Greek had a very clear thinking and very modern thinking. They used to think that living standards should be high. If living standards are high, if it is clean and safe, then people will be safe from illnesses. So very scientific concept, without having any idea of the disease causation. They did not have any idea how a disease occurs. They did not have any idea about any virus, any bacteria, any microorganism, or any chemical factor leading to any disease, or any radiation exposure leading to any disease, any trauma leading to any specific disease. They only think that living should be clean, living should be healthy, diet should be good. If these aspects are followed, then people can be free from diseases. So they used to think that healthful living is the science they has to deliver, which that will contribute to science of health embraces all factors contributing to healthful living. So if they used to find out how a living can be healthful, living can be high quality, and they used to think that through science, for them that was the science, and through that they believed that they can prevent diseases. Then gradually the concept of public health used to come. How it came? The public health came with the understanding of preventive medicine. So earlier, as there was no idea of a disease, people did not know that a disease can be prevented. So what they started following the hygienic practices. It became popular all over the world, though the concept came from Greece. Now suddenly some theories started coming, some evidences started coming, like germ theory of disease. A theory came in the 1850 which tells that some organism or germ, they had no idea about which organism which, but they developed a theory. A theory came that germs are some micro things which can live, living, non-living, whatever it is, it can lead to diseases. So if something can lead to a disease, then they used to think that if we know the cause, we can also find out some ways to stop it, so it doesn't develop disease. So the entire concept of prevention started coming. In 1920, Professor Winslow, see, I am showing these images. Nowadays image based question is also a concept, part of your PG entrance examinations. So these sort of images are also being asked with MCQs. So see, now Professor Winslow, so this was the image of Hygeia. Okay, this is the image of Professor Winslow, photo of Professor Winslow, who defined they gave the definition of public health. Public health is The science and art of preventing the disease. So when the concept of prevention started coming, they were thinking about a science and art of preventing the disease, prolonging life, and promoting health and efficiency through organized community efforts. So from then on, then already the community efforts started coming. They used to started believing that everyone has to contribute for their own health. If a community does not bother about their health and they do not take care of their health, then it is difficult for a service provider or healthcare provider or a department or government to keep them healthy. They have to contribute. So community efforts were also highlighted, such as control of communicable diseases. Then they thought of sanitation. They thought that if dirty things are kept away, we are clean, we can get rid of those germs. And health education. So education, educating people about staying healthy, so as to enable every citizen to realize his birthright, health and longevity. So they started believing, embracing the idea that health is a birthright of every citizen. So Professor Winslow gave this definition: the science and art of preventing the disease, prolonging life, and promoting health and efficiency through organized community efforts such as control of communicable diseases, sanitation, health education, etc. So as to enable every citizen to realize his birthright of health and longevity. Okay. Also, with the advent of prevention, the evidences in support of prevention, the concept of preventive medicine came up. We understood that diseases can be prevented. There are directly some evidences were coming, such as James Lind. He was a captain of a ship, not a scientist, but he did a very informative and very evidence generating scientific research where he showed that scurvy can be prevented by use of fresh citrus fruits. So we can go in detail of the study where he was a captain of the ship, and he found that most of his sailors, they used to have ulcers in their body, which is due to vitamin C deficiency. Of course, later it was known as, the disease was known as scurvy. So he showed that he tried to show that he tried giving them various nutritional supplements, because they were devoid of various food, specific food items. They were lower ration. They were mainly living on cereals and not on other citrus fruit or other healthy diet. So he tried giving them some supplements, and he found that citrus fruits, when he started giving citrus fruits, what he found that he could prevent scurvy among the sailors. So he showed that disease could be prevented by some supplement. Now Celan, another researcher, who showed that by drinking milk inundated with mercury, he could prevent syphilis. Okay, another evident which has groundbreaking fine research in those days, and which has been very specific and very landmark finding in public health, in preventive medicine, is smallpox vaccine by Edward Jenner. Edward Jenner, he found smallpox vaccine, and smallpox, we all know that it has been eliminated. The credit goes to Edward Jenner. So this is the image of James Lind and the image of Edward Jenner vaccinating a child. So this is the image of Edward Jenner. Edward Jenner vaccinating a child. James Lind giving citrus fruit supplementation to his sailors. Again, then with all these evidences, finally Level and Clark defined preventive medicine: the science and art of preventing the disease, prolonging life, promoting physical and mental health and efficiency. So all we are concerned about nowadays, we talk about, in the definition of health you will find, talk about socially productive life. So that those days the term of efficiency was already coming, that a sick person cannot be efficient in work. So to preventive medicine also could have developed efficiency of the people and also the productivity. It was science and art of preventing disease, prolonging life. So they used to think that when people are devoid of diseases, longevity of people will be of life will be prolonged, and physical and mental health will be should be promoted, so that people take care of their own health and efficiency, to increase the efficiency of the people. So also came the concept of social medicine. Social medicine, what is it? Social medicine, the study of man as a social being. Social medicine is study of a man as a social being, his total environment. So understanding the total environment has been its concept like physical environment, biological, social environment. His total environment and environmental factors leading to disease, so that we can intervene against those social factors. An extension of preventive medicine. So it was basically an extension of preventive medicine where social medicine came in. They found that there are certain social factors which were also essential for and playing an important role in leading to diseases, and intervention against and planning against those social factors to prevent the disease was necessary. That is why understanding the society was also very, very important. So people started studying the social aspects and considering the man as a social well-being, because he has to live in a society and rules of the society will be followed. So if, for example, in a society you have to give animal protein supplementation, but that society does not accept animal protein, they are entirely a vegetarian society. To consider that society, you have to find out another strategy how to go through, so that protein deficiency can be handled in that society. Okay, so this is one example. John Alfred Riley, the first professor of social medicine. He was the first professor of social medicine at Oxford University. So social medicine was coming up as an academic subject, and beyond research, it was started to be taught in the universities. And John Alfred Riley in Oxford became the first professor of social medicine. So he basically with his hand, the social medicine was introduced. Social medicine was introduced in 1943 in the Oxford University, and Professor Crewe at Edinburgh. He was also the first professor of social medicine and introduced social medicine in Edinburgh. So this is the image photograph of John Alfred Riley. Professor Riley, first professor of social medicine, Oxford University. And here we have Professor Crewe. He was also an army colonel who was the first professor of social medicine in Edinburgh University. So like our medical study, the social society, like the human body and human physical function, the society was also analyzed in various aspects of its structure and function, like social anatomy. It made the social structure of the society. So the stratification of population of the society based on age, sex, religion, community, and other structures like the economy of the society, the living standard of the society, how the houses are, how its education level is, and what are the social beliefs. Those were the things which were considered as a part of the social anatomy, and people used to study under the head of social anatomy the structure of the society. Then came social physiology, deals with the functions of the society. So depending on various, like our various organs have various function. Based on these function of these organs, our body entire system works in a synchrony. That is how also in a society based on various structures, like how many men are there, how many women are there, how is their education level, how many children are there, what are the age-wise distribution, what are the other social factors, what are the living standards. Based on that, there is a balance in the society and society functions. So the entire functioning, the beliefs of the society, the practices of the society, and the leading to which the interventions which are required in the society. We used to study, people used to study that under the head of social physiology. There was also a head called social pathology, study the defects in the society. So those days they used to think, nowadays we cannot use the term as social defects because every society is independent to have their own beliefs. We have to find out how to practice those beliefs in a healthy manner. So the defects in the society, they used to find out the such social beliefs or social structures or social compositions which could lead to various problems, health problems in the people in within this society. So those were studied under the head of social pathology, social factors responsible for prevalence of the disease in the community. Social therapy, adoption of social and political actions. So what action we should take considering the various aspects of the society so that the society gets benefited as a whole, though keeping their social beliefs and intact. What actions and what policies, what political decisions and policies are to be made so that the healthcare service can be advocated, or that is can be made acceptable to that society, the people of that society. So as we know that a medicine has our clinical medicine has two aspects. One is diagnosis and management. Here also in community medicine, definitely we shall have we have two parts. One is diagnosis and one is management, but it is slightly different. How it is different? In community diagnosis, what we are doing, diagnosis, the doctors were epidemiologists who study the disease pattern of the disease, the epidemiologists, the disease frequency, how many events of diseases occur in the community. We study that in the researchers are called epidemiologists on defined population. Say we define the population first. So say population, entire population of a district or a community, a specific community or a village. We find out how the disease pattern is. What is the epidemiology of this? Means what are the diseases, how frequently they are occurring, which are more common, which are less common, and how those diseases are occurring. What are the causes of those diseases which are frequently occurring in that community? Why these diseases are occurring in that community? To understand that, the epidemiologists are doing their research work, and it covers normal people and sick people. So as it is a preventive aspect, so we have to understand the normal with what social aspects and what social practices and what sort of living standards and what sort of educational belief education they have towards the healthcare providers and what is their healthcare practices. We have to study for both normal people and sick people. Then only we understand that how a normal people being exposed at what frequency and intensity they are exposed to certain social factors and certain epidemiological factors which leads them to their disease. So then only we can design a preventive strategy. The tool is survey based or natural history of disease on epidemiological investigation. So statistical evaluation of healthcare strategies and programs. How we statistically evaluate strategies and programs. There are certain policies nowadays which are being already implemented. So we statistically evaluate them, that after advent of one national health program, how it is working, how people are getting benefited, and what are the epidemiological changes of disease pattern which has been followed. Say smallpox, we know that it has been eliminated. Okay. After how it has been eliminated, Edward Jenner discovered the vaccine and a mass vaccination program took place. So with that vaccination, we have eliminated smallpox in the community. That is how. So this is a gross epidemiological transition that has occurred. Earlier we used to have the smallpox disease, now we do not have the smallpox disease due to implementation of vaccine. So it is statistically very clear that after implementing smallpox vaccination, the smallpox disease has been eliminated from the community. It is no more a public health problem. In fact, we do not at all encounter any smallpox cases in anywhere in the world nowadays. So that is why it is epidemiologically very clear, and that is the benefit of studying the strategies and programs through statistically evaluating them, that what are the benefits. That is how we find out the most cost effective interventions which can benefit our population, most cost effective interventions, cost effective programs, and most cost effective strategies, and also most applicable to the community, most acceptable to the community. We can find out which are the best as per these aspects, which are the best interventions we can give our to the community, considering all these factors, so that the community is best benefited. The community case management, how we are doing it, how it is different from our case management in clinical aspect or case management in a healthcare facility. So case management provides healthcare to the people of defined geographic area. So here we find out not only a particular person, we find out what are the diseases that can occur in a geographical area, and we plan for prevention. Say an area is malaria prone, so we plan accordingly that what are the logistic, means how many rapid diagnostic test kits, how much quantity of drug will be required for treating. So we have an idea of a geographical area, we will plan accordingly. So that is how we do community case management. We find out what are the disease pattern in the community, and we prepare accordingly, we plan accordingly, we remain prepared, and we give intervention to prevent or cure the the cases which come up in the community. So we plan for the entire community, train for the entire community, and we treat the entire community. And by treating some cases, we sometimes in many cases, for many diseases we also prevent the transmission. That is how, if we treat, say, one malaria case we have treated, we have cut down the transmission, or when TB case we have treated completely, we have cut down the transmission from one TB patient to another TB patient. That is how we have prevented transmission of disease, and that is how we are also treating the entire community. So the community which might have tuberculosis as a big problem, many TB cases used to come up in a year. By treating the existing TB cases, we are cutting down the transmission, and now there are not many TB cases. The case of TB has come down in such aspect that there are not many TB cases. It's no more a public health problem in that area. Only very few TB cases sometimes sporadically comes up. So that is how we treat a community. Now both active and passive operational strategies are applied. In clinical medicine, people will be with all their facilities, they are waiting at the healthcare institutions, so that whatever case come, they are ready to treat them. Here we apply both active and passive operational strategies, where we also actively move out in the community, do surveillance, look for people who might have the disease, even though people sometimes they might not know. That is the these are the aspects of community medicine where which are to be understood by the people who are doing MBBS third semester. You have to understand, it is not only about treating the cases which are coming to you. Sometimes people do not know at all that they are having a disease. So we move out in the community and look for the cardinal signs of diseases in the people. Signs and symptoms we find out for those who are having. We assure that they avail the treatment facilities. So that is a active approach. For example, many people might not know that having fever might be a case of malaria. What we are doing in the government health system, people are the volunteers, the ashas. We may have heard of asha. I'm talking about the people who are doing in the third semester, accredited social health activities. Those ladies who are resident of that community, they move into the community, they find out the fever cases and do the testing at home, house to house visit, that do the testing and try to find out if people are having malaria. If they are having malaria, they advocate them for availing treatment, and treatment is given free of cost. So this is an active surveillance approach. And passive is, of course, we are sitting at our healthcare facilities, and those who are sick, they will come to the healthcare facility, and we shall do whatever test is necessary and whatever treatment is to be given those people to those people. So this is passive operational strategy. So here we are doing both active and passive. Active strategy is not there in the curative medicine or in the tertiary care facilities. It consists of service in the outreach and health facilities. So we have various level of health facilities. We are having health and wellness centers, PHC or UPHC. Those are also a next level of health and wellness centers. Then we are having community health center or CHC. We are having, in our state, we are having sub-district hospital. We are having district hospital. We are having state hospitals. We are having medical colleges. In all this, we are giving preventive services also, but we are also doing outreach services like health camps, outreach services like such as health camp, village health and nutrition day, okay, screening of high risk groups, so these are we are doing by outreach, or we are also going, sometimes we are going out there with MMU or mobile medical units with our vehicles which are having diagnostic facilities like X-ray, portable ultrasound, ECG machines. We reach out to the community and we do outreach activities. So that is also another part of the community case management. So somebody may ask a question that some tertiary hospitals are also doing these such kind of outreach activities. Yes, of course they are doing it, but we are talking about the service, the definition of the service. If they are also doing outreach activities, they are also definitely providing community case management services. They are we cannot confuse it with the hospital case management. That is not because of private corporate hospital is doing that curative outreach service. That does not mean that service is becoming a hospital based service. That is also outreach service which is being provided by that corporate health institution or prime or tertiary care health institutions, where their doctors, paramedics and nurses, they are reaching out to the community and giving their services. That is also community case management. It is a community case management is a comprehensive service which includes preventive. We look about, first of all, if what we do, we find out if there are any cases. Now after finding the cases, look out for how the case can disease can transmit from one case to the from an affected person to the normal person. So we also jump into the preventive aspect, that how to prevent disease from transmitting from the diseased person or affected person to a person at risk, who is not a disease but he is at risk, he or she is at risk of having the disease. We find out a way of prevent the disease from it. Promotive, then we give we promote the healthcare services. What are the services we have, what sort of treatment we have which are free of cost, and how with availing those services people can prevent those diseases. Of course curative service is a part of it, but curative service is not the main focus, because curative service is being given by everyone, not it is not required that community medicine to focus on curative services. Curative service is a part of it, but our main focus, our main responsibility primarily, which is not done by anyone else, it is preventive and promotive service which we have to give. And curative service also we should not forget, we have to cure the person who is having the disease as well. That is why it is medicine, though it is medicine applied in the community. And rehabilitative services, we can reach out to people at a level where people have developed certain complications of a disease. Then we have to think about developing a chance so that that person can lead a socially and economically effective life. For that we have to rehabilitate that person and give them and develop some ability so that that person can lead his life effectively. And there we also look into intersectoral operation, like some in many cases in public health aspect in the community, when we want to implement, we have to look into it as a whole. So we develop a intersectoral coordination. Along with the health department, we develop coordination with other departments also, health related departments. For example, a very relevant example is education department. So there are certain various programs like Rashtriya Kishore Swasthya Karyakram, where what we are doing, we are reaching out to the school, we are training the teachers who will be giving, eventually after being taught, being trained, these teachers will be giving health education to the students, because the students will follow their teachers as idols. So when the knowledge is delivered by through the teachers, it will be much more acceptable to the students. That is why in Rashtriya Kishor Swasthya Karyakram, we are training the school teachers who will be giving health education to the students. Now promotes active participation in the operation of national health programs. So national health programs are such programs which are developed so that to help the community as a whole to get rid of common health illnesses which are public health problem in the community. These are so prevalent that these are very commonly encountered in the community and in such a big number that they are called as public health problem. So we develop national health programs. Now we motivate the community, we advocate our program and develop interest in all sectors, starting with the government, starting with the community leaders, starting with the political leaders, starting with other sectors, departments, and the people as a whole, to take interest in those programs, to avail the services. They should be interested to know that what are the services available in the program. If they are free of cost, they should be made aware that these are the services which are where quality is also maintained. Sometimes people do not believe that the services which are free of cost provided by government, they may be of good quality. So we have to assure by legalization, by various testings, that the drugs, that is the medicine for treatment, and the diagnostics which are being given free of cost to the community through these national health programs, they are of high quality, and they are having a technology which is the latest at considering the most cost effective and most available and most acceptable to the community. So something which is the community can afford, they have the sufficient money, or the government can give to the community. There may be various options. As per latest research, we shall choose such things which are of high quality, based on latest research, and as well as the government can has sufficient money to provide, or the people have sufficient money to contribute and avail those services, which can also be made available close to the people. So if the people are residing in some area, they will have those facilities available near to them, so that they can avail those services. So considering all these factors, people have to be made understand that these are the services they need to they can avail through these programs. That is how they develop interest and give high cost benefit ratio. So the point I have already explained, that cost benefit ratio, people will, the services which will be beneficial and cost effective, so that it can be given to everyone. So this is the entire concept of community medicine, and the services which are being provided by the community medicine. We have to be very clear about the concept, that what are the things, how we are going to learn. It is the same thing we are learning which is there in clinical medicine, say clinical pediatrics, gynecology, obs and gynecology, and other clinical subjects. But here only the understanding is different. It is putting the entire clinical knowledge in a frame, where which is that frame is of cost effectiveness, available technology, affordability, and acceptability in the community. So with this, I will close today's chapter. I hope that this chapter will be The points I have noted will be useful to everyone, and it is also I have tried to illustrative as well as concise with the same time. I hope that it will be understandable to everyone, and it will help you to also memorize certain areas so that you can crack whatever questions are asked to you in your theory, in your viva, or in your PG examinations. You can also share your comments, any area which is not understood by you, or any limitation in the PPTs, in the material, or in the analysis, or in the illustration. Anything you want to add, so that I can improve my video next upcoming videos, and classes can be much more interesting to you. With this, I'll close my videos. Thank you everyone. Wish everyone good health and all the best.